Greetings. I am Walt Bauer, and I'd like to welcome you to the Human Development Institute's second spring seminar. My short visual description is I am a white male wearing glasses with a blue and white checkered shirt with a collar. My pronouns are he, him, his. My video background is a 3-story brick academic building that has offices for the Human Development Institute on the University of Kentucky campus. The sun is shining next to the brick building. We welcome all the participants who are joining us today. Our presenters will provide an opportunity for questions today, and we welcome questions from all of our participants. Please type your questions for our speakers in the Q&A box for a robust question and answer session. If you hover over the bottom of your screen, you will see the Q&A option. Please use the chat box for technical questions. You are joining the webinar on mute. There is not a participant video in the webinar room. We have live captioning for this webinar in the closed captioning feature. Turn on the captioning by clicking on the closed caption button at the bottom of your screen and then clicking Show Subtitle. Should you have any questions about CEUs, you can contact me. My email address is walt.bauer@uky.edu. Again, that is Walt, WALT.BOWER@uky.edu. Please take a moment at the conclusion of the webinar to complete our brief evaluation. The evaluation will be sent to your email address after the webinar. It is really helpful as we plan for upcoming webinars. The title of today's webinar is Improving Services for Children and Adults with Neurodevelopmental Disabilities through the Kentucky Lend. I'm now going to turn it over to Dr. Rumroll, the Director of Research and Training at the Human Development Institute. Dr. Rumroll.
Thank you, Dr. Bauer, and I want to extend my welcome and gratitude to all of you for joining us for this seminar regarding the first year of our Leadership Education in Neurodevelopmental Disabilities project. We began this July 1st of 2021, and this is the first time that Kentucky has had one of these LEND projects, and we're very excited about the activities and outcomes of the first year of our project. And we have with us today several members of our, two members of our faculty, and also 3 of our trainees who are going to share their experiences. And we believe this will be a very enlightening program, and want to invite you all to get involved in any way you wish to with our activities that are oriented toward improving educational, employment, and healthcare outcomes and quality of life for people in Kentucky with autism spectrum disorder and other neurodevelopmental disabilities and their families. The mission is a mouthful, and it's been a very busy year, and we're just really, really delighted that you could join us today. This LEND project is funded by the Health Resources and Services Administration, which is an entity of the United States Department of Health and Human Services. I'm phoning in today. Dr. Bauer gave his visual likeness. I'll give you mine. I'm a 53-year-old white male. My pronouns are he, his, and him. I just got a haircut, so I am now officially bald, and I have hazel-colored eyes. I'm wearing a plain red shirt with a collar, and I'm unlike Dr. Bauer's very descriptive background. I'm in front of a nondescript white wall, so nothing very interesting about that. But we are delighted that you're all here with us. We're very excited at HDI to be rolling out this first year of the LEND, and you're going to see from this entire program today with our full panel of participants that we have hit the ground running, and some really great things are happening. And I'm gonna turn it over to Dr. Caroline Gooden, who is our steadfast project director and who makes everything in this program go, including this presentation. So Dr. Gooden, with that, thank you for organizing this panel. The floor is yours, and we're looking forward to everything you and our partners have to say. It's all yours, Dr. Gooden. Thank you.
Thank you so much. And I am Caroline Gooden, as he said. I am a white female with glasses and light hair in a purplish colored sweater. I'm glad that you all are here for us to share about the Kentucky Lend. We are all excited to share about this program with you. As you will see, we all have lots of enthusiasm for this project. Our presentation team today includes Dr. Marissa Toomey, who is one of our Lend faculty, and she is at the UK healthcare system with the Department of Developmental Behavioral Pediatrics. And we also have 3 trainees who will share with you: Hannah Mitchell, Morgan Turner, and Caitlin O'Neill. And they will each tell you a little bit about themselves as they share about their Lend experiences. So to tell you a bit about the Lend, as Dr. Rumrell indicated, we are one of many national programs. In fact, there are 60 Lend national programs. We are fortunate to be one of. It really offers a unique intensive training experience for long-term students, short-term students, and medium-term students to learn about how we can best support persons who have autism and other developmental disabilities. Our students and our faculty come from all disciplines across the spectrum. We offer experiences in training in clinical and leadership skills for professionals across the state, as well as for self-advocates, students, and families. It's a collaborative interdisciplinary training program. Again, we bring in faculty and experts from all different fields and all different realms of services for persons with disability. And we really have exciting class sessions every week. The purpose of the Lend is really to improve outcomes for children with disabilities and their families across Kentucky. This is a Kentucky-based, Kentucky-strong program that we believe will make a real difference in the lives of persons with disabilities in Kentucky. Our leadership team at the Kentucky Lend includes Dr. Rumrell and myself, and also very importantly, Dr. Kathy Shepard-Jones, who is principal investigator of this project. And without those 2 lead persons, we would not have this Lend in Kentucky, along with our other Lend faculty who you will hear about. I also want to tell you just briefly about some of the partners who made this Kentucky Lend possible. We have state partners, including the University of Kentucky, great support for this project, University of Louisville, and Eastern Kentucky University. All of those universities contribute faculty and students to this project. UK Healthcare is a big supporter. The Kentucky Cabinet for Health and Family Services, the Department for Behavioral Health, Developmental and Intellectual Disabilities, big supporters of our work. The Kentucky Office of Autism and the Innovative Supports for Autistic Workers program. Just some of the few partners that we have across the state. Some of our national partners include the National Center for Prenatal and Postnatal Resources, including Stephanie Meredith, who's one of our faculty members, the National Training Center on Mental Health and Developmental Disabilities, the Center for Dignity in Healthcare, and the Learn the Signs Act Early program. So these are examples of some of the national programs that also support our work and with whom we collaborate. So to tell you a bit about our faculty, as I mentioned, Dr. Marissa Toomey is here and she will share with us next. Dr. Melinda Alt is our special education faculty. From Communication Sciences, we have Janine Schmedding-Bartley and Jonine Lohman. From the Physical Therapy Department, we have Susan Efkin and Elise Kearns. From the Child Development Center of the Bluegrass and UK Pediatrics, we have Angie Fulchek. Bev Harp is our self-advocate faculty. Stephanie Meredith is our family faculty. And Walt Bauer, who you met at the beginning, is our course instructor and our pre-service coordinator. At the University of Louisville, we have 2 faculty who are instrumental in this Lend project. That's Greg Barnes, who's in neurology and pediatrics, and Scott Tomchek, who's in occupational therapy. And last but not least, at the Eastern Kentucky University, we have Myra Beth Bundy, who is a great support in clinical psychology and school psychology. She has both been a Lend trainee and is now a Lend faculty member and a great supporter of our students. So Marissa, I will turn it over to you, Dr. Toomey.
Hi, Marissa is totally fine. Is everyone able to hear me okay? Does anyone mind to nod if they can hear me? Great, thank you so much. This is a photo from about a decade ago, but that's okay, everyone, because I am a Caucasian woman with dark hair and a dark sweater who is pretending she's not approaching middle age. So if you enjoy the photo, imagine that's what I look like. And I'm a developmental behavioral pediatrician here at the University of Kentucky. I'm happy to tell you a little bit about myself, about my own LEND experience, and then some of the things we're doing here in the LEND with me. And okay, for the next slide. Oh, should I advance it? Do I have the power? Thank you. So first and foremost, my background started with my family. So I am one of two siblings. I'm the older one, of course, because I like to be in charge. And my sister, her name is Devin. She turned 36 yesterday. It was her birthday. And she has autism and she has intellectual disability. As a result of growing up in a household with a sibling who has autism, and being the older sibling, I knew two things. Number one, I wanted to provide care for folks who have autism. And number two, I wanted to be in charge. And so I decided to take that into the world of medicine. So after college, I went to medical school at Loyola University in Chicago. And then in order to be in pediatrics, once you graduate from medical school, you have to do what's called a residency. It's 3 years if you do pediatrics. It is not as exciting as they make it seem in Grey's Anatomy, but I did meet my husband in residency. So that's one thing I can bring, to the table. After I completed all 3 years of my general pediatrics training, I did a fellowship in what's called developmental behavioral pediatrics at the Children's Hospital of Philadelphia, or what I'm going to call CHOP. And so for developmental behavioral pediatrics, the 3 years are spent either working with families and children where the children have disabilities. This could be making new patient diagnoses for things like autism or developmental delay or preschool ADHD. It could be some medication management of ADHD or self-injurious behaviors. But also there was a component of community resources, finding out who is in the area and going there, along with the research project. And then as part of my first year of my developmental behavioral PEDS fellowship, I did a LEND fellowship at CHOP, which was awesome and which I'd love to talk about next. So as a trainee, we had our sessions on Mondays. So the Kentucky LEND is much smarter and we have it on Fridays now. I feel more energized on Fridays than I did at 8 a.m. on Monday mornings during my LEND training, but that's okay. So we would meet every Monday. We had a series of seminars and class discussions. I took this from the CHOP website recently, and many of these were the lectures that we received in my LEND training. You'll see things like family professional collaboration. You'll see research in neurodevelopmental disorders, feeding disorders, assistive technology. And then we often had discussions after class related to the topic that day. And on the next slide, so we also had a couple of different components to what was called our individualized training program. So we had interdisciplinary experiences, which for us, we were set into 2 different teams, and we had some case-based conferences. So each of our teams would sort of research the case that was presented to us and provide differing perspectives based on what our area of expertise was about elements of the cases. My family experience when I was at CHOP was that I was working with one of the families at the Pediatric Stroke Center, and not the medical side of things, but really the family's experience. And then for our advocacy component, I went, at the time we were allowed to go in person. So I went to the AUCD Disability Policy Seminar back in Washington, DC in 2013. There were a bunch of us who went. It was actually a fantastic trip. We got a lot of new information that informed our own practices. But just as a side note, our LEND group was fun, and we all got to hang out, which I think is within the spirit of LEND itself, is camaraderie. And then I found these pictures because apparently I take pictures and I just don't delete them off my phone. But we had a research component to our LEND, and on the left was when I presented at our LEND poster day. And it was the very beginning of my fellowship research project. And it morphed its way over to the right, which was my fellowship research project, which I presented that poster at the Pediatric Academic Societies meeting in San Diego back in 2015. And so just to show you that the work in LEND grows and grows and moves your career forwards. And I have picture evidence of it this time. So at UK, I have taken my training from my fellowship and then my experiences within the LEND that I participated in. And I have hopefully used it to inform my clinical practice. So I'm an assistant professor of pediatrics here in the Department of Pediatrics. And that means I'm young enough to still call myself young. I'm also an attending physician within the Division of Developmental Pediatrics. We have 3 attending physicians, and we have 3 nurse practitioners, and we have 2 psychologists right now in our division. There's a mix of full-time and part-time in there. But we're very fortunate to be able to work together. We also have 2 family support specialists and some clinical staff, and that's growing right now. Within my responsibilities, besides seeing patients, which I'm going to talk about next in terms of what I do and how that relates to the LEND, I'm also the rotation director for our pediatrics residency rotation in developmental behavioral pediatrics. So there are some rotations that are not required when you are a resident. There are some that are required. You have to do a couple months in the neonatal intensive care unit. You have to do a couple of months in the pediatric intensive care unit. You have to do adolescent medicine. And you also have to do developmental behavioral pediatrics. So all of the first year residents, or what are called interns, who are either in pediatrics or internal medicine pediatrics, come to our clinic. And some of the LEND fellows who work with one of our medical clinics that I'm going to speak about will also get to sometimes see our residents around. There is the upcoming Kentucky Echo Autism, the Extension for Community Healthcare Outcomes, which is one of the American Academy of Pediatrics recognized programs for teleconsults. Essentially, you have a panel of experts in a topic who do monthly or twice a month or weekly teleconsult sessions with community providers. And I'm going to be one of the members of that panel. And then I'm also one of the 2 UK College of Medicine faculty representatives for the LEND. So it's fun to be on the other side of things. I feel like one of those people who did Top Chef and then they did okay on Top Chef, but they got to come back and be a judge. I like being a judge better. It's way more fun. So no, as a faculty member in LEND, the first thing that has absolutely stood out to me is that the discussions in this current group of fellows are phenomenal. I love the energy level of the fellows. Again, Friday mornings, way more energetic than we were on Monday. But everyone brings their own perspective, and I feel like it's really fresh perspectives. Everyone has a different side that they bring to the discussions, and being able to see that, and whether I'm seeing it in the chat when people are talking to each other there, or whether it's something they're saying out loud, it's really, really great to see the level of enthusiasm that folks younger than me are bringing to the field and are going to be bringing to the field as they develop their own careers. I'm just really excited. Again, I was first a sibling before I was a physician, and I think I'll forever be a sibling first. And so just knowing that there are people who care as much as those of us who have loved ones care, it's a beautiful thing. I also try to help support recruitment of new LEND fellows as we're recruiting. I've given a lecture, and I hope to give more lectures as time passes. And I've had a couple of small group discussions where it's kind of a one-on-one or a couple of fellows with me, just talking about various topics within the field and parsing through some of their own experiences. I hope to have more of those too as time passes. Unfortunately, COVID and influenza A took me out a little bit more than I expected this semester, but what we have been able to do, I think, has really also been exciting. Getting to have those almost like office hour type discussions where there's a little bit more personalized time, I think is meaningful. And then I'm at MAC, so the Multidisciplinary Autism Assessment Clinic. It's one of our LEND practicum sites, and I'm happy to share more about that. So we, actually the person who is blurred behind me, and I, Megan Carter, one of our division's nurse practitioners, and I are responsible for the evaluations for the youngest kiddos that are referred to our clinic. So 18-month-old to 5-year-old children who have been referred by their either primary care provider, or sometimes it's their pediatric neurologist or their genetics doctor. And they are being referred specifically for an autism evaluation. The way that the visits work is usually the resident physicians and I do the telehealth consultation, and that's part of the resident's training experience for how to ask a developmental history. But then the second part, which is really the fun part, the LEN trainees have been involved in, and this would be the in-person multidisciplinary developmental testing day. So because we ask most of our questions on telehealth, we don't have to spend a lot of time just sitting, we get to be active. And so the patients come and they see, I think this might be on the next slide, I apologize. Yes, they see our occupational therapists and our speech therapist who are from UK Pediatric Therapies at the Child Development Center of the Bluegrass. And they do what's called the Mullen Scales of Early Learning. That's a standardized developmental test to get a sense of a child's fine motor abilities and visual problem solving abilities and speech and language abilities. And then I usually do the Autism Diagnostic Observation Schedule, or the ADOS. So besides me and our speech therapist and occupational therapist, we also have our family support specialists, and they are, they're essentially the people who support everything that I do, and I could not do my job without, as they are a wealth of information about resources in the state. And I don't know what my next bullet point is, so I'm going to say it's okay. Yes, there it is. So our occupational therapists often have the families fill out a child sensory profile to get an idea of a kiddo's different sensory-based strengths or weaknesses. And then on my end of things, we have parents complete the adaptive behavior assessment system, which gives us some insight into where the child's self-care abilities are at the time of the evaluation. We certainly know that can change over time. At noon, all of our testing is done and we get to have a team meeting. And if Shelby, one of our awesome LEN trainees, is on this call, she knows that I am talkative. She could probably fill in the blank with that. I talk a lot. And Shelby has been at some of our MAC team meetings. We have great discussions. So everybody is able to give their input. We all have equal amounts of time. So it's truly multidisciplinary. It's not just me sitting there. I promise I do stop talking at some point. We've had LEN fellows. Shelby did some of the speech evaluations when she was there, and she was able to tell me what she thought was going on with the patient. That to me is the ultimate LEN experience, right? To not just to be there, but also to be actively evaluating a child, presenting the child in a multidisciplinary format. I thought it was great. And if Shelby is here, she did a phenomenal job. And then in the afternoon, we have feedback visits with families. That is when we are able to take the information from our telehealth and integrate that with what we talked about at the noon meeting regarding the testing results. And we give diagnoses and recommendations. Sometimes the child ends up having a medical diagnosis of autism made. Occasionally, it turns out that the child does not meet criteria for a medical diagnosis of autism. And then we still have the opportunity to talk about other resources within the state for things like occupational therapy or speech therapy or feeding therapy.
Shelby is here, I think, in listen-only mode, Dr. Toomey.
What's that?
Shelby is here, I believe, in listen-only mode.
And Shelby, you're great. Thank you for being
showing her picture later.
Lend. And I think next slide, please. Yes. And so hopefully the relevance of MAC, or the Multidisciplinary Autism Assessment Clinic, to LEND is the fact that more and more of developmental pediatrics, and really more of neurodevelopmental disabilities, is identifying individuals who meet criteria for a medical diagnosis of autism. So the current prevalence, which we know is based on 11 states through the CDC's autism monitoring program, it's 1 in 44 8-year-old children who have been identified with autism. And so I think MAC brings some of the youngest children with autism into the clinical picture. And if you're willing to share the next slide, I stole this. So if Tal Curry is on this call in any way, shape, or form, thank you, because I stole this from him. But it is important to recognize that having trained in other states and being from Massachusetts, I can tell you that all of my patients in Kentucky are as awesome as all of my patients in Pennsylvania were, and are almost as awesome as my sister. I think my sister's the most awesome of all, but I'm kind of biased there. But all of our patients are extremely worthy of the highest level of medical care and the highest respect from families and community providers and medical providers. And so the numbers are here in Kentucky as well. And I appreciate being able to be a part of some of our families' journeys. And then on the last slide, it just shows you that if you click the button, it will do this magical thing where like little circles will pop up.
Click which button?
The advance the screen button.
Oh, let's see.
Yes. Okay. It's going to happen. So this also was stolen from Tal Curry. Once again, thank you if you're here. Sorry, I stole. But this is one of the more up-to-date listings of who does autism new patient diagnoses within the state. And so that everyone on here knows that LEND and MAC are hand in hand, there is Kentucky Children's Hospital. We are glad to be a part of this team. We are really, really excited to continue to collaborate, and I appreciate all the LEND fellows who have come with us up until this point. And I know that we in our team look forward to many more who are to come and join us.
Thank you, Marissa. And I'm going to ask Dr. Bauer, are there any questions in the Q&A for Dr. Toomey?
We do not have any questions in the Q&A
Okay.
quite yet for Dr. Toomey.